Today we're doing a full walkthrough of the ResMed AirSense 11, from unboxing to setup, cleaning, and tips for long-term use. And by the end of this video, you'll feel confident setting up and maintaining your brand new device. So let's get to the unboxing. You start with a really cool little travel bag that comes with it, with the handle, and you'll notice there's a section on the back here that you can pull out, so when you are going traveling with a suitcase, you can actually pull the handle up and slip that over the top there, so it's really easy to ride on top of your suitcase when you're carrying that through the airport. And there's also a shoulder strap as well. So when we open the bag up, everything is really clearly labeled as far as where things sit. So we've got diagrams here saying that the power cord is down the bottom, we've got the device and the humidifier here, and your tube and your mask go up that end as well. So that's Velcro there. So inside we have the device, the CPAP machine itself. We have the humidifier chamber, which we put water in every night and empty out. The heated tube, and the power cord. You'll also find in the bag some manuals and other sort of documentation. Also interesting to note, the AirSense device also has an inbuilt cellular modem, so it's connected to the internet via mobile data, and we're able to log in and monitor your therapy and adjust settings for you and make you more comfortable. We can do all of that without you having to leave your home and come back to the store. That's why we have a really cool support team that's on hand to do that for you. We can also pull therapy reports, talk you through them, email them to your doctor. If you've got a doctor's appointment and you want to see how you're going, that's no dramas as well. First time setup. Plug in the power, attach the heated tubing, fill up and insert the humidifier chamber, and fit your mask to the tubing. Then you turn on the device with the power button on the very top. In the next section, we're going to cover the user menu options. So this is really what new users need to know. So we're going to cover the My Options menu and the Sleep Report menu. Within the main menu section of the AirSense 11, we have two sections. We have My Options and Sleep View. So let's run through My Options. So when you click on My Options, the very first thing you'll see there is ramp time. You see that I've turned ramp time off. What ramp time does is it starts the device at a lower pressure than what your standard start pressure is supposed to be for a period of time, whether that be, if we click on it here, 5 minutes, 10 minutes, up to 45 minutes, or set on automatic. What automatic means is it'll wait till you go to sleep, and once it detects that you're asleep, then it will go to your start pressure and then start treating you. When you have a standard CPAP machine that's on a fixed pressure, ramp is really useful, and that's what this was really designed for. However, because it's an automatic machine, we set the minimum pressure to be comfortable for you. That's your start pressure, and we have the maximum pressure, and the machine will operate within those parameters. So there's no need to have a ramp on when you're using the automatic mode for most people. So I prefer to keep it off, because otherwise the device is not treating you until the ramp has finished. And so we want to treat you straight away. So ramp time is off. Pressure relief is on. Pressure relief is where the device backs the pressure off when you exhale. So it gives you full pressure when you inhale, and then as you start to exhale, it relieves the pressure, so you're not trying to breathe out against as much pressure that's coming in. So that's a comfort feature that we always leave on. Climate control is on auto, and so is the tube temperature. And what this basically means is that the device will decide, based on the ambient room temperature and humidity levels, where the humidity levels and the heated tube needs to be. Just so you're aware, when you put water in your humidifier chamber, that silver bottom of the chamber is a heater plate, and that gets warm, and that releases moisture into the chamber, which the air passes over the top of and picks up and goes into your tube. That's the humidity level. So the reason why we have a heated tube which is also set on automatic, is because there's a copper cable all the way through the tube, and this warms the air of the tube to stop excess condensation from getting in your tube and having water in your mask. Another reason why we prefer to have your machine lower than head level, so if you don't have like a short bedside table, sometimes it's good to put the device on the floor, because you won't get any excess condensation that might happen to come through, won't flow through into your mask so much. So you might end up with a bit of gurgling in your tube at some point, which means there's too much condensation, and we can then if we need to, put these settings into manual and adjust them from there, or our support team can help do that remotely for you. Mask setting. So on the mask setting, you can click on this here, and we have three options: pillows, full face, and nasal. Depending on the mask that you have, you can select the right one for you here. However, I will say that if you have a mask that has a short tube on it, so like a P10 or an N20 or any of those ones, even though you might have a nasal mask that has a short tube, even an F40 for example, if it's got a short tube, you're going to choose the pillows option. If it's a full face mask with an elbow, like an F20 for example, you choose full face. And if you have an old school nasal mask that has an elbow as well, maybe not using a ResMed mask, maybe a Fisher & Paykel Eson or something that's just got an elbow straight in instead of a short tube, then you would choose nasal. But surprisingly, the majority of the masks that you'll use are on the pillow settings here. And press OK. So these other options here, Smart Start. Smart Start will start automatically when you first start breathing in. If you take 2 or 3 deep breaths into the device will turn itself on automatically. Subsequently, Smart Stop does the exact opposite. So once if you take the mask off, it'll blow air everywhere for a few seconds, and then it will turn itself off. So that's the main menu in My Options. Then there's a plus button here for more. So warm up is a great way to preheat your humidifier chamber, kind of like if you put the electric blanket on in winter, you want to warm up the bed, so you can pre-warm your humidifier chamber. So that means that your humidity is more effective faster when you go in to use your device. Mask Fit is a great option, especially for drying out your tube. What Mask Fit does is when you put your mask on for the first time, especially if you're trying to set up your mask and get the tensions right on the straps, you can run the Mask Fit option and press start, and it will give you a series of pressures that it will blow, and it tells you if you need to adjust your mask or not to get the right seal. So you see that we can stop there. So it's a great option there for really titrating yourself to make sure that you've got a good mask fit under higher pressures when you're first getting started. And the My Air app. If you haven't downloaded the app here, great idea to do so. You'll get a daily score of your sleep quality based on a variety of different variables, and you can dig into those variables as well, and it keeps it daily on your device. So that way you have access to summary data of your sleep quality then and there. So you can just follow the prompts here, press OK download, and you'll be able to scan the QR code and go and download that app and set it up from there. All right, I'm going to run you through the sleep report now. So this is really cool, especially if you're aware of what your original sleep study results were. So you would be familiar a lot of the time, once you have your sleep study, they'll tell you if you have mild sleep apnea, moderate, or severe. So in a nutshell, if you have 5 or more respiratory events per hour, which is also called an AHI, but if you basically stop breathing 5 times or more an hour, you have sleep apnea. So mild sleep apnea is between 5 and 15 times an hour. Moderate sleep apnea is between 15 and 30 times an hour. And anything severe is over 30 times an hour that you stop breathing. So if you are aware of what your sleep report is, or maybe you just remember whether it's mild, moderate, or severe, that sort of gives you an idea of how many times an hour you stop breathing. So if we click on My Sleep View, this gives you a snapshot of what your sleep was like last night. So you can see here my usage was 8 hours and 21 minutes. my events per hour was 1.9. So a long way under 5, which is great. And when I did my sleep report initially, I stopped breathing 28 times an hour. That was my AHI. So to be 1.9 times an hour, that's fantastic. And obviously the reason why I feel way better on CPAP than I do without CPAP. And then the mask here, this will tell me how good my seal was, and it says my mask seal was great last night, which is fantastic. There's a little arrow just here, so you can click on that and go down a bit further. Actually, so you swipe up, sorry. And so this gives us the average hours used on the device. So 8.4 hours is my average. The machine sits at a average pressure of 8.2, so my start pressure is 6.4, but when my device is on automatic therapy, it goes up and down all night, but over the extended period, my average works out to be 8.2 centimeters of air, which is what has helped treat my sleep apnea. My average leak and my average AHI. So the AHI, which is the events per hour that we have, is 1.9. 0.4 of those is obstructives and 1.3 is centrals. So there is a difference between obstructive sleep apnea and central sleep apnea. Your AHI, which is your overall events, is your combination of what we call hypopneas, which is a narrowing of the airway, and then your apneas, which is where you fully stop breathing. And there's two main types they track. One is obstructions, which is classic obstructive sleep apnea, and the other one is central apnea, which is there is no obstruction, it's more a central nervous system thing. And more on that in some future emails and blogs on cpap.com.au. One thing I'd like to emphasize here is it's super important to stick to the standard user menu and not really enter the clinical menu. If there's anything that you need to know, any adjustments that need to be made, please give our support team a call. They're experts in what they do, and they'll be able to help you and guide you, and even do it for you remotely. Another really cool feature of this device is that it has the care check-in module, which means that if you keep an eye on the screen from time to time, especially over the first few days to a week to a month, the device is going to ask you how you're feeling and try and guide you through adjusting to therapy. Now let's go through the cleaning and maintenance. It's important daily to empty your humidifier chamber and then refill it with either fresh, distilled, or clean boiled water out of the kettle. I use boiled water out of the kettle because it's easy to access. As long as it's been boiled and is room temperature, that's totally fine as well. If you notice any cloudiness or calcium buildup within the chamber, feel free to order some Eco Chamber Descaler off the cpap.com.au website, and also make sure that you have some smart CPAP wipes handy as well for both your mask and your device. On a weekly cycle, we want to be washing our mask as well as the tubing and the humidifier. To do this, simply submerge them in warm soapy water, rinse them well, and air dry them out of sunlight. Remember to replace your filter every sort of 1 to 3 months depending on the environment, and sooner if it's dusty, so regular inspections is also important. Use smart wipes to wipe the exterior of your device and keep it nice and clean. I'm going to share with you a few little CPAP hacks that we find really useful for adjusting to therapy. The very first one is to check out our video called How to Sleep with CPAP, which is on the CPAP Direct channel. If you haven't seen that already, it's an 8-minute watch, and it is really, really worth it, especially for first-time users to go through. It's a little bit entertaining as well, but definitely check that video out because it's got a ton of really helpful stuff about placement of your device and how to really get the most out of your CPAP therapy. The second thing I'll mention is to fill your humidifier to the maximum line, but don't overfill it because you have risk of water getting into your tube and all sorts of issues from there. But it's good to make sure that your device has got enough water in it to be able to last the full night, and remember to empty it the next morning and then replace the water before you go to bed the next night. Another helpful tip is to keep your CPAP machine lower than your head height. This is because we don't want the backflow of water flowing back into your mask if you have any excess condensation for whatever reason. So please keep your CPAP machine, ideally on the floor next to you if you have a tube down type of mask and you've got the tube in the bed under the covers with you, or if you've got one of the top connection tubes that go around the back, just try and have it slightly elevated off the floor, but not at head height or higher, please. My final hack for the video is a really good one. If you've washed your CPAP tube and it's still got moisture in it, or you're finding that you've got excess moisture in that you can't seem to get out, what you can do is disconnect your mask and then run the mask fit option for 10 minutes. You'll find that in the main user menu under the My Options, there's a little plus sign there. So you go into there and you can run the mask fit, and that will help really flush out, run air all the way through your hose to make sure that we get rid of any excess moisture, so that way you've got a nice dry hose for your next run. So that's your ResMed AirSense 11 walkthrough from box to bed. It may take weeks to get used to, so remember why you started this journey in the first place. And you know what? Remember, you're not alone. We'll always be here to help you with your CPAP journey. As a CPAP Direct patient, you have access to our expert clinicians that can remotely adjust comfort settings for you and troubleshoot any teething issues that you may have. Reach out anytime. Happy sleeping.